There is an issue in our country. In the United States of America, the richest country in the world, thousands of people suffer every day for the simple reason that they do not have access to affordable health care. Prescription and basic care prices are astronomical, and the cost of insurance is not much better. Our current system is centered around employers offering a discount to their employees, but there is nothing in place that requires them to do so. It's a broken system, and it's time to start thinking about how we can fix it. That is where single-payer healthcare comes in. So what is single-payer healthcare? It is a system that has been proposed through bills such as the Medicare for All Act that would provide every citizen, regardless of employment status, age, class, or income level, access to healthcare. It would offer 100% coverage for all health-related needs. Primary care, prescription, emergency care, and even vision and dental would be covered, because even though our current system tries to deny it, our eyes and our teeth are very important to our health. I'll give you an example. When I was in my 20s, I fell and broke my maxillary bone, which is the bone between your nose and your front teeth. I didn't want to go into too much detail about it, but it was broken badly enough that it changed the way my teeth were aligned in my mouth and I was unable to eat. I went in for surgery, and I was told that it would not be covered under my medical insurance and that I would have to use dental, which I did not have. Thankfully, I was able to get a loan from my parents to cover the surgery, but others are not so lucky. Under single-payer healthcare, everything about that injury would have been covered. The ER visit, the surgery, the prescriptions, and even the root canal. And it could have been done in a much more seamless way than it is done now. Our current system of multiple payers and multiple billers is overcomplicating the industry, resulting in patients receiving multiple, very confusing bills for the same treatment. Going back to the example of my fall, I received multiple bills from the hospital. There was one for the visit itself, one for the x-ray machine, one for getting the x-ray, and at least one or two for things that quite honestly did not make sense to me. Then there was the statement of benefits that came out from the insurance company, which were not bills, but by the end of it, it was very hard to decipher what was owed to who, and that was all for an injury that was honestly pretty clear-cut and minor compared to what others face. Imagine what it would have been for someone going in for an unknown, life-threatening illness that keeps someone hospitalized for weeks. Single payer removes that confusion as well as some of the excessive administrative costs that go with it. The chart on this slide was taken from cdn.americanprogress.org. It shows the percentage of medical costs that were administrative and then what percentage of those costs are related to billing and insurance, or in other words, what costs could be avoided completely with a single payer system. Administrative costs are just a drop in the bucket of problems that can be solved with a single payer system. The way our current system is set up, we have to rely on our employers to provide discounted health insurance, but there are no standards in place that dictate how much coverage they need to provide or at what cost. In fact, there's nothing to say that they need to provide it at all, which leaves thousands of working Americans unable to afford basic health care. A problem which was beginning to be corrected with the Affordable Care Act, but we need to take it a step further to eliminate it completely. Everyone deserves access to affordable, quality health care. We have the means to create a simplified system that will ensure that not one more American will lose a family member because of being denied a life-saving service, simply because their employer does not provide the insurance needed to cover it. We can make sure not one more life is lost over an unaffordable prescription, and we can do all that with a single-payer system.